Well, formally welcome to our lunchtime session, a partnership between the team at Women's Health Victoria and Women's Health in the Southeast. That's the WHISE logo there, where we wanted to sort of share with our colleagues that work in parliamentary and representative offices and roles about the data that's available on women's health. Now, the reason that we did this is because often when we are visiting representatives or the offices and the parliamentary offices, we are often asked about data. What's the data on women's health? And it struck us that maybe there's the opportunity to share the tools that we have access to and that are publicly available, just to help the work flow a little bit more and just to make sure that you know that it's available and how to access it. It's really important, though, I think, for WHISE and Women's Health Victoria, and I know for many on the line today, that we do take a moment to just all acknowledge that we are on Aboriginal land, unceded lands of Aboriginal people. WHISE lives, works and plays on Bunurong land. I'm actually coming to you today from Wurundjeri land. Tara and Jenny, where are you coming from today?
Wurundjeri.
You're on Wurundjeri? Yeah, great. So we just all want to pay our respects to Aboriginal elders past and present. Always was, always will be. As I said, the purpose of today, well, we really want people to sort of understand what the data sources are about them and how to apply them and work them. And we'll probably give a couple of case studies a go as we go. We actually want to build people's capacity. It's always, always, always in our mission to build the capacity of the people we work with so that we've got that sustainable understanding in community about women's health and well-being, but also the drivers of that as well. But inevitably, what also comes out of this work is the relationships and partnerships are strengthened as well. You get to know us, we get to know you, and that can only be a good thing. So the partners today are two of the women's health services in Victoria. There are 12 women's health services. They've been around for, I think, 30 years, 30 plus years. WHISE is down in this little bit of the corner down here in Victoria. We're in the southeastern metropolitan region, and we have we're a not-for-profit organisation, and we're health promotion, primary prevention people. And we work on prevention of violence against women, sexual reproductive health, mental health, wellbeing as well. So that's a little bit of what we do, but we work in partnership and collaboration. And I'm Tara, who will wave now, so you know who Tara is. Tara and I are from WHISE, and the amazing Jenny Ward is from Women's Health Victoria. Jenny, do you want to say a little bit about what Women's Health Victoria is and who you are? You're a statewide, so you cover all of that region.
Yes, we are. So we're one of 3 statewide that are part of the Victorian Women's Health Program. So we look at, the systems and structures in society and things which help women to stay well and what we can do to, as it's statewide, to enhance that. There's also the Multicultural Centre for Women's Health and Disabilities Victoria, having a statewide focus as well.
Thanks so much, Jenny. And we are funded by the Victorian government to do what we do. We thank them for their support. Like all good women's health services and all good health people, we like to evaluate what we do. So the first request we're going to ask, and this is really important for us because what it enables us to do is to see, are we hitting the mark? Are we doing what we should be doing? Is this a valuable use of your time? So in the chat, I'm just going to put the link to the form that we've got, but you can also pick up your phone, the ubiquitous phone, and take a photo of that QR code, and it'll take you through to why can't I do? Oh, that's why, because I don't think it'll take you through to a form, and I'm just putting the link in there now, where we just a very small 2-minute survey, but we'll do one at the end to see if there's been any difference that we have made in your lives, as it were. But while you're doing that, let's just go on to a bit of the agenda. So we're going to introduce you today to 2 resources on women's health. The WHISE environmental scan, which really focuses on the data, qualitative, quantitative, the range of evidence bases that are for women's health and wellbeing in our region against our priorities and what we see the issues are. That'll be led by Tara. And then Jenny is going to walk us through the great resource that is the Victorian Women's Health Atlas. we'll probably have a bit of a conversation, raising any questions, and then we'll ask you to give it a go on 2 scenarios that we think, well, we hear regularly that are asked of us as well, but might be very practical for you to give it a go. Let's just go to the big picture before I hand over to Tara to talk about the scan. As people that do women's health and wellbeing, when it comes to data, I guess, in the context of that, there's some key challenges about why we keep going back to data. Having disaggregated data by gender, and more we want to know and talk about gender in the broader sense, and also data that enables us to understand the intersectional barriers that people face. If you can have the data and the evidence base, it actually gives people more options. It actually gives policymakers, program developers more options, because we understand the world a bit better. But having that data is an ongoing process of evolution, and Jenny and Tara will talk about that, and they'll talk about what they're able to present and why. If we don't have this data, we often see in our day-to-day work what we call gender bias in the health system. And one of the recent ones of that is endometriosis, that recently, because we've got more data and understanding about endometriosis, we're able to create programs and policy and health systems and supports that better support that experience. But clearly there's more work to go. Another one is around women's pain. And a classic one is cardiology, where we know women and men's experience of cardiology differs, and we have better data about that now as well. If we don't have that, if we have gender bias in the system, we actually have poor health outcomes. So the dollar that gets invested, the resources, the people's time, they're not doing the thing that they need to do. So those are some of the key challenges. But the way forward absolutely is, and everyone's on a learning journey on this. It's all a collaborative and collective effort over many, many years, governments, programs, and people, is getting that disaggregated data and the evidence and research on intersectional barriers. And even yesterday, the Gender Equality Commissioner came out and talked about the intersecting barriers that people face in workplaces. We see more of that being produced through health research as well, particularly around First Nations people, women with disabilities as well. Coming at it from a social determinants of health perspective. So we're not just looking at people as a disease, that we're actually looking at people, as humans with rounded and big experiences that they bring to their lives, that their disease or their illness sits within as well. So having that and thinking about health from primary prevention to clinical intervention. But the other thing too is what we know is that local community-based approach to address intersectional barriers is really important. And more people like WHISE and Jenny are, we're proud to be a part of those local collaborations around solving those local problems and challenges that stop people being well. And data is part of that. And enabling people to know that the data exists so that they can learn and understand and grow is a key part of what we do. So that's just a bit of a bigger picture. So with that, I might stop screen sharing, and it's my absolute delight to hand over to my colleague, Tara Cortell, who is going to take you through the Women's Health in the South East resource, which is called what we call the WHISE eScan. Now, I'm just going to share the link for that in the chat. And Tara, this has recently been updated, so it's slowly getting updated on the website. So if you do log on and it's taking a little bit of time to chunk through, just refresh or opt out and come back in again. But over to you, Tara. Thank you. Oh, Tara is part of our research and policy team at WHISE. Thank you.
Hi, everyone. As Kit had with that lovely introduction, my name is Tara. I'm the Research and Policy Officer at WHISE. So as Kit mentioned, I'll be talking about our environmental scan. I'll be referring it as the eScan throughout this presentation, though. So the agenda for this presentation is I'll be talking about what the eScan is, how the eScan can be used, how do we actually transfer this data into actions, and then I'll be referring to a case study to demonstrate this. So the eScan provides a snapshot of publicly available information that is divided in 4 content features. So our data is disaggregated by gender. It's also divided by the LGAs in our region. We also provide a data analysis for each of our indicators. So for instance, we provide meaning to the data by telling a story. So for example, if we're presenting a table on gender disaggregated data on unpaid carers within a particular region, we'll also demonstrate why women might be taking up more caring roles than men by providing some evidence-based information on gender stereotypes, for example. And with this example, we will also provide an explanation to why then women might be taking up more caring roles. We'll also provide policy analysis to data as well. So we analyze what is currently happening in the current political environment and provide an explanation to how this is related to the data that's being presented. So for example, with the recent inquiry into universal access to reproductive health care, which resulted in the deregulation of the medical abortion pill known as the MS2 step. I guess the next step for us will then be analyze whether this has resulted in an increase of the uptake of this medication and analyze which LGA areas are experiencing barriers for taking up this medication. And I guess a broader analyst would also will also be, I guess, analyzing whether there are whether this reform has any gaps and what needs to be reformed and whatnot. So additional resources on the website also include the environmental scan as a PDF document, environmental fact sheet, which talks about what is the eScan and how it can be used, the environmental scan summary report, which has all the data in a summary, comprehensive sort of document, as well as the policy sort of analysis in a more kind of comprehensive and compact analysis as well. So where do we get our data from? So we get it from 2 main categories, publicly available data, such as the ABS census, as well as Crime Statistics Agency and so forth. But we also get it from resources that are also similar to the eScan, such as the Victorian Women's Health Atlas, which Danny will talk about in a moment, as well as Hayden Brown, who is a data analysis, which sends out, he creates really comprehensive and accessible sort of data Excel sheets, as well as Forecast ID, which provides data for LGAs across Australia, which is really cool. So as I mentioned, our data is divided across the LGAs. So the reason why we do this is because it really highlights the diverse needs amongst various demographics within the IGAs, as well as the differences between the LGAs themselves. And it's to inform our work effectively, such as content for workshops that we'll be delivering, whether one LGA needs, there are barriers to sexual reproductive health, for instance, so we would put a workshop on that sort of content. And also advocacy works and resources. There might be an LGA that will benefit from one compared to another one. It also informs us, I guess, which councils will benefit or would more likely to take up collaborative work as well. So for instance, an LGA might want a report on gender differences in their region yeah, so I guess things like that, thus create different workshops depending on what those reports spit out. So the framework that we use to take up, that we use to analyze the data are the social determinants of health. And we do this through a intersectional feminist lens. So the social determinants of health are economic and social conditions that influence individual and group differences, as explained by Kit as well. And we do this by demonstrating how systems of power and oppression, such as racism and sexism, interlock to shape people's lived experience, health and well-being based on their multiple identities. So for instance, race and gender. And I guess by using this framework, we're able to then understand our region in greater depth and thus create more effective targeted primary prevention resources and programs. So for example, emerging trends highlight how social determinants of health are strongly influenced and shaped by certain indicators. So that could include access to income, education, and gender. And the indicators that we use is ones such as mental health and well-being, population data, health statistics, crime statistics, and also income disparities. So for example, as you can see on the graph, it demonstrates that the SEIFA ranking that the Greater Dandenong area is actually one of the most disadvantaged LGAs of all of Victoria. So how do we choose which data we actually want to include within the eScan? So as a lot of the indicators and trends that I've mentioned are connected to our priorities one way or another. So for instance, gender equality, whether that is the gender pay gap, prevention of violence against women, family violence statistics, sexual and reproductive health. So for instance, which LGAs are more likely to take up to have barriers when accessing the medical abortion pill or mental health and wellbeing. So who are accessing mental health services more? So why is this all important? Why am I talking about this? Well, not only is gender disaggregated data, without it, we're missing half of the world's population, but gender statistics capture specific realities of the lives of women and men by demonstrating and providing insight into specific trends that differentiate women from men and vice versa. So whether that is trends in unpaid care and domestic work, demonstrating the gaps of female leadership within, the government or who is taking CEO positions, demonstrating how different LGAs might have higher barriers to certain medications, providing insight into the discrimination of women and girls in the workplace, such as the gender pay gap, providing insight into violence against women and girls, family violence statistics, and lastly, providing insight into gendered harmful practice. So, for instance, even child forced marriage or female genital mutilation. So, and these are just a few examples that I'm discussing today. There's a lot more. So I guess what can this data actually be used for? So academic research, such as the production and producing reports, for instance, or enhancing, which will, I guess, then result in enhancing communication technology, whether that is campaigning or resource development, which then feeds into advocacy, feeds into accountability. So, actually providing insight into areas that need reforms, need additional funding, need services and programs, as well as policy decisions. What policies need amending to actually reduce the health inequalities. So I'm just going to show you an example of how gender disaggregated data can actually be used. This resource, so Health Planners resource. So myself and the SRH team created this resource, which was aimed at local councils in our region. It was based on SRH content, and its objective was to demonstrate how to use their municipal health and wellbeing plan to create policy actions and decisions within their council. So it was double-sided. So the first side provided high-level data of their region of SRH, as well as what SRH actually is. And then on the other side, provided examples of what potential actions they can actually take up, which then mirrored their plan on the other half. So as you can see on the left side, showed what their municipal plan is and the different goals that's actually in their plan, whereas the other half actually mirrored how actions can match and what they can actually do with it. So why is this relevant to you? Well, primary prevention needs to include the gender realities of community. And what I mean by that is that in order to effectively protect and share power with women, we need to understand where this power is limited and where and how women are suffering. And this is to ensure agency and self-determination in their lives to make decisions about their health. And one way to do this is to understand the root causes of health and social problems and inequalities. I guess the other half of this as well is meaningful collaboration is also important. And this is to, I guess, identify opportunities to participate in, co-design of advocacy resources or campaigns or program development, but also to help us improve our current resources, such as the eScan, as I'm presenting today. So it's actually accessible to stakeholders such as yourself, so you can use it in your work. And that's all I have.
Thank you so much, Tara. That was excellent. I think we're going to send some resources out to participants after this, and I think we'll absolutely make sure that that case study you talked to is part of that. what we'll do, folks, now, we'll have a Q&A in a little bit, but what I might do now is just directly hand over to our Jenny Ward, who is going to take us through the Victorian Women's Health Atlas. So Tara Cortell sort of spoke to some of the broader matters that drive our collection and use of data in our region, and you've got a link to our eScan there. But I'm just sharing the link to the Victorian Women's Health Atlas. And Jenny, I'll hand over to you because I know that this is going to be a bit of an exciting presentation for this resource. Thanks so much, Jenny.
What I have is a handout which contains these slides, which you'll be sent around at some point, and I'm doing a slightly cut down version in the interest of time.
Thank you.
So, okay, the Victorian Women's Health Atlas, the URL is at the top, is a free and publicly accessible website containing, it now has 73 indicators of health and well-being, and each one is mapped for every local government area in Victoria. So from Alpine to Yarra-Yambiak, you are assured of getting data on all of those things. Before we go into this, the Atlas does have some topics which may be sensitive or confronting, and in today's session we'll be covering things like intimate partner violence, mental health, illicit birth. So if you need to take time out, or we will put up some support services at the end for agencies that assist with those issues. And if it's an issue for anyone, we understand it. You need to do what you need to do for your own well-being. So we're going to jump straight in. And from the menu, we have 8 different categories, and you choose the one of interest. We're going to start with mental health. You then get a list of all of the indicators in that section, and we're going to go into mental health conditions, which is one from the census, and we're going to select the rate, the population rate per 10,000. It's very tempting to look straight at the map, but I would like to suggest that you always look at the text at some point, because it's got very important context, which helps you to talk about the data, put it in the context with some broader information about why this may be an issue. In particular, we'll talk about why it's an issue for women. And it also has definitions, and it's important to know, are you talking about people of all ages, in which case you wouldn't say women, you'd have to say females. It'll tell you whether you should be using the word victim or affected family member. It's important to use the language that is accurate for the data set that you have, and all that information is in there. So it starts with the statewide map, but we have the opportunity to drill down by region. So obviously we're going to be quite interested in Metro Southeast. And so you choose the region button, the drop down will appear, and you choose Metro Southeast. This will now cause the map to zoom in on the Southeast region with every local government area displayed. And it always starts with the map for female. And at the bottom, the bar chart is ranked. All the local government areas are ranked by the dark purple, which is the female value. So you can easily see which ones are higher or lower, and the labels are turned on there for you. At the touch of a button, we can click on the male tab in the top right-hand corner, and the map now changes instantly to map the values for the male values. And the bar chart now sorts by the male values. And you can turn on or off the female and male bars if you want it to look a certain way. But what if we want to know more about a specific local government area? What you can do is you can click on any local government area to find out more information, because otherwise it'll give you the Victorian statewide. And you can click by clicking on the map, or you can click on the bar chart. Either one will allow you to highlight something. So we've clicked on Frankston, and now you can see it's highlighted on the map and bar chart. We're back to looking at female values. I should explain that. And you can see now we've got the Frankston values appearing, and it's showing us the rate per 10,000 for mental health conditions is for female 1,401, and for male 908. So clearly there's a bit of a difference there for Frankston. The key on the right-hand side shows you, what's in each colour range, and this one's a traffic light. So obviously green is progressing towards lower rates, which is what we'd like to see. Darker red is progressing towards higher, which is a worsening according to the health targets we'd like to see. So it's a very visual way of demonstrating regional differences at a glance in a way that having these things in a table of values could never do, and especially at the statewide level even more so. But it's a very stark way to communicate something very simply and quickly. Now, there's other things we can do, because you'll see there's a view more section there, and there's other things we've got. One thing we can do once we have any single map on our screen is we can print this out, and there's a tab there. Looks like a little bit like a car on a windscreen, but it's actually a printer. Click that, and it will cause a 2-page PDF to be generated with the map and bar chart on the first page. It's whatever you've selected. So if you've highlighted something that's got an orange border and a highlight, it will have it on. Or you can not select that and just have the whole region without Frankston highlighted. And then the text is just the same text, whatever one you are generating. But again, it gives you the context, gender analysis, what the definitions are. So the text always travels with the outputs. It's important that we always provide that. Now, what if you wanted to change? Then the blue tab allows you to change, and you work through the navigation. You can pick, we're going to pick sexual and reproductive health, adolescent birth, and there's only one measure which we'll pick, and there's only female, which makes sense. So what we're now seeing is the map for adolescent birth. And I've put this one up because this one has a lot of years that we've mapped. This one goes back to 2012. And we have a time slider. So when there's more than 1 year, time slider turns on, and one dot is 1 year, and you can slide to and fro. Now, a clever thing you can do for trends is you can view any two measures side by side by using the green compare measure. So we're going to choose the exact same map, but we're going to drag the time slider on the left to 2012, and on the right, keep it as 2020. And you can see visually that the depth of colour has reduced over time, indicating that probably it has lessened over time. That's what it looks like. But let's see what's actually happening in an LGA. So we're going to pick Frankston again, and we can see, okay, that's the figure for 2012. And we can now look at the view more graph, and it shows actually what has happened over the years in Frankston in a different sort of a format, showing it's declining. And that is consistent with statewide what's happening with this particular situation. So if you hear people saying, you know, that the problem of teenage pregnancy, etc., maybe that is or isn't true, and probably isn't true. Victoria, most of Victoria, there'll be exceptions, but this is a good way to just see, is it really growing, declining, or what's happening? There's also in the view more section, you can get a fact sheet for your local government area, in this case Frankston. This particular fact sheet will contain all of the stats for sexual and reproductive health, and this is the 5-year table for the one we were just looking at. And this will give you Frankston, the Metro Southeast regional average, and the Victorian statewide average. So you can track, benchmark, how are we going, not only within our local area, but in our region and compared to the state. Sometimes it'll be higher or lower. Now I'm just going to look at some other scenarios where you may want to use the compare measure. An important one is we want to compare the number of instances of something, or the count. So we're looking at intimate partner violence. This is females affected in each of these areas. So the number of incidents reported to police where a female was affected. So obviously we'd use this where we need to know things that may impact on, say, response services, people needing assistance, whether they be male or female. There'll be a certain number, and certain areas will have a higher number of instances, and it may be partly to do with the population profile of that area. And so how many people are affected? Where are the needs? Are they in the right places? On the other side, we have the rate per 10,000. And this is showing, you know, proportionate to the population in the area, how, you know, what is the rate? And we can use this to say, how are we tracking over time? Are things going up or down? is it consistent with our targets? Are we hopefully seeing things plateauing out or declining? It's what we'd like to see. But again, we can see why is one area perhaps doing better than another area. We can look into that. We can investigate. We can look at putting resources where they're most needed. So Casey has the highest count, but then it's got a massively growing population. Frankston has the highest population rate, and you would know from your areas why that perhaps is happening, but could utilise that information. Here's, I just want to highlight that we're adding some more of the health questions from the census, and here's one that's for dementia, mapping male next to female. Shows obviously Mornington is very high for both, and that might be an issue where more resources need to be provided in that area, or how to provide them. And just finishing up with the fact that there are some shortcuts on the Atlas menu. When you go into it, you can get the logo takes you always back to the start. You can also get a whole lot of other things there through the shortcuts, one of which is you can get straight to all the fact sheets for your local government area without having to go through any maps, which was demanded of by our users. So you can go straight to Frankston and get all of them for each of the areas, and all the indicators will be there with their 5-year tables. We also recently have added some broader key national and Victorian statewide sort of guides to kind of some of the key data if you need broader context, bearing in mind the Atlas has just got LGA and sex, male, female. And there are some things we find it very hard to get the data for. So for some of those populations on the right-hand side, such as Aboriginal and Torres Strait, LGBTIQ and so on, we just can't get very much data. So we've given you some of the broader reports, statewide reports and things, if you want to, click the link and go and have a look at those. And now just finish with the slide as promised, with some of the help and support services for some of the topics we've very briefly delved into today. And that's it from me.
Oh, Jenny, thank you so much. That's just amazing. Thank you.
Shall I stop sharing now?
Yeah, why not? And I think what we might do is just do a bit of a Q&A, if that's all right. So just open it up to people to ask any questions. But I might ask one, if I may, to start us off, Jenny.
Yes.
One of the people that registered for this information session, this webinar, said that they were interested in information about endometriosis. I was just wondering if you could describe, I might ask you next, Tara, if the Atlas speaks to maybe prevalence, or because that's often what people come to us. They want to know how much of something's going on, don't they?
Yes.
Does the Atlas currently speak to prevalence of endometriosis? And if it doesn't, why doesn't it do that?
Currently, if you looked on the sexual and reproductive health section, you would not find an indicator for endometriosis, but it is on our wish list of a number of
you have a wish list.
SRH conditions that we want to get. Now, this one where we would get it from would be hospitalisation data for reasons of endometriosis, but we would have to ask the Department of Health to supply a custom report, as we already get hospitalisation for self-harm. For example, we've mapped, which is a case of one of those type of stats, and we're going to have it's on a list with hysterectomy, caesarean birth, and endometriosis, all those three.
Yep.
And we're even wondering if we can get something about pelvic pain, but we're not sure if that one can be isolated. So it's on our wish list, and we hope to get it within 12 months.
Wow, thank you. So what you're actually saying is that the Atlas presents the data that's publicly available. What the Atlas does is then lays it out, or translates it and disaggregates it.
Sometimes it's not publicly available, and only by us getting it does it become publicly available.
Okay. Yeah, right. Yeah. What's an example of that, Jenny?
Well, the self-harm one is not published any other way. We also have been now mapping medication abortion, which has caused great excitement in the sector, because it shows where the women are located who receive the scripts, where the doctors are who prescribe them, and where the pharmacies are that dispense them, which has shown massive deserts of supply, namely Grampians, and Western Victoria is not a great place to get those services. But you know, it really shows it very starkly
Very
in
stark.
the maps, and people are using that for planning.
Brilliant. The power of data. So Tara, for our region, does the eScan website and report talk about endo, for instance, that our colleague asked? And another question that this colleague asked is data about LGBTIQ plus experience. Does our scan talk to that? If it does, or if it does not, why doesn't it do that?
I guess similar to Jenny's answer, if it's not publicly available, we can't map it. We don't, so we only map our publicly available data. So once the Health Atlas has data on certain health conditions, we can then use that data to kind of inform how the eScan, inform the eScan. With the LGBTQ, we have data. The data that we use is from, the ABS. So we have population data of the LGBTQ community in our region. So we've actually mapped out who identifies as LGBTQ and how many in each region, and we were able to do that by a survey by the Department of Health in Victoria in 2014. So that's the only survey that has been conducted. There has not been any recent data since then. But again, most of the data is quite binary. So that's what we have access to.
Yeah, interesting. Excellent. Thank you so much, Tara. Just wondering if there's any questions or comments that anyone would like to raise at this point, given we've got Tara and Jenny on the line to answer any or all of your data query needs, because next what we might do is think about a bit of a case study. People might have a sandwich in their mouth, drink, might be a bit tricky. Put it in the chat if you like. I think that point you make about often the data is binary, you know, that the data collects and then it forces a view of the world as well. So if I could add value, I think one of the things we're hoping to lead people to is you can get the data, but then the question is, what meaning do you make of it? You know, how do you then use it? How do you further explore it as well?
Perhaps I could mention one other thing.
Yes, please, Jenny. Yes, please.
In the next Atlas update, we're going to have one more intersectional data indicator. By that, I mean a subset of an existing indicator by a population group. We're going to be mapping family violence where the affected parties are First Nations people. And that's going to show a really high degree of disadvantage compared to even the already not great situation with, you know, experience of violence generally, but it's going to show much greater rates, population rates in those groups. And it's obviously going to differ between areas, but we are keen to try and include more of that data. It's a slow road to get it in there, but we are trying our best to, if people have suggestions, you know, we always want to hear what people think is important to try and get hold of, and we'll advocate to try and extract it out of the agencies, because they might have it, but just not publish. And we can ask for reports. We can, and you've got your environmental scan to then also add another layer of analysis to that, which is great because so many of the other regions don't have anything like that.
Yeah. Jenny and Tara, there's a really great question from May in the chat. May I ask, do you have any examples of a case where policymakers have used the Atlas? Now, I have got one that I'm happy to talk to, but I'm just wondering, do you know any off the top of your head?
Yes. And in fact, we've just done an evaluation of the Atlas, and some of that information is coming in, and we got the report only yesterday and we're just going through it. But the main one I can think of is the medication abortion data being used to actually try and help locate where the next sexual reproductive hubs should be around the state. And the Auditor General's office also utilised this data when making reports on access to sexual reproductive health services.
Yeah,
so along with data from 1-800 My Options, which was on the ground, you know, talking to people. But
so that's a live example. You've got the Auditor General using it as well.
Yeah.
The one I can think of, if I'm really honest with you, is say when the Department of Health evaluates service delivery, they do draw on the Atlas to help inform the priority areas as well. So I can't speak for the specifics of that, but I do know that they do call upon that atlas.
And we also have local health planners in many of the
Yes.
councils using it for their health and wellbeing plans. It is a recommended resource to support that process, along with a whole lot of other resources.
Yep. Tara, do you know one off the top of your head? Or?
Not on the top of my head, but I'm thinking in the case study in the presentation with the SRH health planners resource. So
Yeah.
the eScan, not just the health atlas, but the eScan really helped to kind of inform and develop that resource, which I guess local councils will be using to inform their policy decisions.
Yep.
So that's sort of the main one.
Yeah, that's right. And that's an example of partnership with the system between the council, in this case WHISE, to help flesh out that requirement of a local health plan.
Exactly.
Yeah, absolutely. All right, folks. Well, we've only got a few people on the line, so I thought I'd put us into break groups, but I don't think I'll do that anymore, because I think that's if I don't have to separate people out, I won't do it. But what we'd like to do is to start seeing how you might put this into practice. What I'd invite you to do is, in the chat, I've actually shared with you the link to the eScan and the link to the Women's Health Atlas, but I'm really happy to share that again, or Tara might have that up or something like that. Here I go. So here is the Women's Health Atlas. She goes there, she does that, she goes up here, she goes to the chat. There's the Women's Health Atlas. So I invite you to sort of open a new window on your screen and bring that up. And then we've got the WHISE eScan. Oh, I've just sent it. Have I just sent that to you directly, Tara? That's what I've done. Tara, you've got the eScan.
I did that.
Tara,
Yeah.
if you can share the eScan. No, that's fine. I cast the first turn. That I do that all the time. And what we'd like to do is kind of share with you, or maybe have a bit of an example of you using the eScan to kind of do one of these examples. And I thought what we might do first is go to number 2, because we are regularly being asked, I don't know about you, Jenny, but we're being asked at WHISE, which is absolute our pleasure to do so. We love doing this. But to help local constituency officers run women's health forums. Yeah, women's health forums. So one of the things we thought we'd do is, using the Atlas and the eScan, maybe give people the opportunity to think about, well, hang on, what topics do you think would be able to be covered? What topics do we think would be able to be covered? I actually think we've got, a few people here were from Southern Melbourne, and then we've got Councillor Claire Harvey, who's down around the Frankston Peninsula way. So I'm just wondering what we might do. I might stop sharing and perhaps bring up and share my screen when it comes to the eScan and the Health Atlas. So let's give this a go. Has anyone got any comments that they'd like to sort of offer first about how they might go about thinking about? Tara and Jenny, you might do this as well. How you might start to think through what are the topic areas that we might do if we've got a local forum about women's health and wellbeing for our region. What sort of things might first come to mind? What about you, Tara and Jenny? When you're thinking about local forums, what's sort of the things that you start thinking through?
I guess specific experiences that we know women solely experience. So for instance, menopause, or sort of other reproductive health experiences that women go through. Yep.
Absolutely. What about yourself, Jenny? Where do you often go to? Family violence is often one, but there's often ones that are overlooked. You were telling me the other day too.
Yes. I think it's good to have a range of topics, because, depending on the demographics of your area, you want to have something that might spark the interest of people. You might also have, we often know areas where there might be a big divide, either geographically or by female, male, where we might want to highlight that as an issue.
Yep.
I guess always gendered violence is one that it's nearly always one that we would want to promote something in the sexual and reproductive health area,
Yep.
and perhaps something even in the social determinants of health or socioeconomics.
Yeah.
Now, the Atlas has a list of all the contents in the shortcuts area to the right, list of indicators. You can click on that and just get a one-pager, which is the whole contents, and at a glance you can just see, what might be of interest. So that's a really easy way to have a good look at what's there.
Absolutely. And Claire Harvey has actually made a very good point, which is that in the Southeast Council's Climate Change Alliance, the impacts of climate change on women's health is one that's particularly of use. If we go to the e-scan and the emerging trends, is that something that we've started to connect with, Tara?
We don't have data per se, but we do have data analysis and policy analysis.
Yeah.
So we have collected, I guess, reports that have been developed by different departments and different journal articles that kind of highlight issues within these topics. However, there isn't really gender disaggregated data that has been formally produced by like ABS or public safety or anything like that. So it's been quite interesting, but we have, I guess, started collecting data from different reports. And
and this is the example, isn't it, here, where we've actually got that policy analysis on our website that sort of identifies what the possible impacts are with that social determinants lens. So those that are new to that might look at it and go, well, that's not health or anything like that. No, but it's a social determinants lens. So Councillor Harvey, I hope that answers your question. But maybe what we do is we think about a particular region as well. If I go, we might go to sexual reproductive health then, and perhaps what some of the things. Oh, someone's written a new message. The Atlas doesn't have climate change. We possibly do national data or so on to add to the series. Excellent. Thank you so much. So Jenny's just let us know, or let me know, that the Atlas doesn't have climate change, but possibly do national statewide data resource on it to add to the series. And I think that's certainly a theme that's coming up again and again. So sexual reproductive health is something that's often talked about when it comes to women's well-being. You could look at birth, you could look at adolescent birth, there's the medication abortion. You could also look at total fertility rate as well. Why, Jenny, would we want to look at total fertility rate as opposed to birth?
Well, total fertility rate is really showing whether the population is replacing itself over time or not, and it shows that fertility rates are declining.
Yep.
So that can be a long-term planning issue, depending on the demographics of the area, aging populations, fewer younger people. It's just one of those measures of where a population's heading, and it's really, the trends are very much the same Australia-wide, but the birth rate over the last 30 years has massively declined in this country.
Yep, thank you. What about we look at something that is coming more and more because of the reform journey that the country's on, which is around mental health and wellbeing. And we look at perhaps some of the indicators, gendered lens on indicators around mental health and wellbeing. And I think people are often surprised to know that there is a gendered experience of anxiety and depression. Jenny, I think that's right.
Yes. Now, a lot of this data comes from the Population Health Survey, and they only disaggregate by LGA and sex every 3 years. So just bear in mind, a lot of this data is from the 2017 survey, and they didn't do it in 2020. So, the next data we'll get to update this will be at the end of this year with the 2023. Okay. So we are urgently awaiting that. So just bear in mind, this data is from 2017, but it's still the best data we have.
Yep.
It's Victorian, and it covers all local government areas.
Right. So let's just imagine that we're wanting to say, well, should our Women's Health Forum for our region look at mental health and wellbeing, anxiety, etc. So we could go and have a look at, and this is exactly what we'd go and have just make sure that we're having a look here at the definitions, like Jenny said, and then perhaps go to the region, which is Metro South East.
Yep.
And again, this is looking at female prevalence of anxiety and depression ever diagnosed in 2017. And already we're starting to see that there's particular incidence prevalence in Frankston and in the outer regions here too as well. Is that what you see when you look at that, Jenny and Tara?
Yes. And you'll notice even when you look at clicking on anything, it does give you the male value there in the little square box, and you can mouse over the bar chart. So you can clearly see that it does seem to be a divide by male-female that's pretty persistent through the whole bars there.
Yeah.
That's a really easy way to tell. Oh, yeah. And you could then do compare measure and throw up the male alongside if you wanted to do that.
Yeah.
So pick the exact same one, but down the bottom, click male.
Show for male.
Yep. And you can make your screen a little wider. I mean, it's a bit squished up left to right, but it's still there, and you can see, oh yeah, there is definitely a divide in that one.
Yeah.
So we don't have the way of printing that out, but you can do a screenshot of that, and all of the information will be included if you just grab the whole thing, including the bars and including the headings up the top.
Yeah.
You can do a snapshot of it.
Yeah. Very powerful indicator. So for me, if I'm looking at that and I'm saying local health forum, perhaps around, any of the areas I think in our region, then mental health and wellbeing is a priority as well for information sessions as well, particularly in how we do work to prevent it. Thanks so much. The eScan, how does the eScan maybe add value to any discussions around mental health for you in our work at WHISE and through the eScan, Tara?
So we use, as I mentioned, publicly available data on mental health and divide it by not just gender, but also LGAs particularly through like ABS and the Health Atlas and so forth. And so with one of our priorities being mental health and wellbeing, it's quite interesting looking at which LGAs have has sought out mental health services more than others. So for instance, if we want to do a workshop on mental health prevention, and we notice that there are some LGAs that there are barriers, we might decide to do a workshop on, okay, what are help-seeking behaviours? What are actually are preventing communities from seeking help? Is it cultural reasons? Is it other reasons? So I think what's really awesome about the eScan is that it really kind of dives into sort of not only what the data is producing, but also sort of those sort of social determinants of health, those explanations to why the data might be presenting the way it is, which informs what sort of work we need to do in order to kind of, what sort of work we need to do to improve the health inequalities within our region.
Yeah, and here we've actually got the content that actually draws from one of those other pieces of resources that the Atlas doesn't talk to, which is Australian Department of Health research on older women, which is older but still noteworthy, and also talks a little bit more on some of the state-based policy reform as well, and what that means too.
Yeah, so for instance, we know that there's a loneliness epidemic, which feeds into, for instance, women. As we know, women are experiencing loneliness more than men, particularly because women are more likely to live alone. Yes. So it's quite, so just noticing and analysing those sort of disparities. Yeah,
thank you. Has anyone got any questions? I don't want to stop anyone putting anything in the chat or raising more questions, but if we have got time, and we've got fewer people than we thought we were today, so we might end a little bit early if that's all right with everyone. But Jenny, I might just do one more example with you if that's all right.
Sure.
One of the other queries that WHISE often gets lies around, prevalence of family violence, for want of a better term, and often we're asked to think about or put forward some information about local prevalence of family violence, which can be a bit of a top tier indicator, isn't it? We can often only see the victim survivors, but there's often a bit of a narrative around it.
Yes.
And one of the narratives that's growing in our community is the understanding of the impact of that on children. If we were wanting to have a little bit of a look at family violence in a local region, but try to understand how many families or children would be impacted by that, what would you recommend is the best way to go?
Well, certainly in terms of the Atlas, we do have one of our statistics devoted to that, and that is family violence, child present. So if you look there, it's
there it is.
that one. So what it is a subset of all the reports that came in of people affected by family violence. This one specifically asks, was there one or more children present? So if you perhaps click on reported incidents, for want of a, we've got to start with one, and this is the number of reports that had this. And we go into our Southwest region again as well. And so this one, we've been mapping it for a few years now. So we've got 5 years worth of data. And if you wanted to, you can actually, let's click on the one that's darkest there, which seems to be Casey. And then you could click on the view more graph, because this is going to be pre and post COVID, which will be interesting. So you see there's a view more white thing. Yeah, let's click on that. So that's showing what's happened there. And so it's showing that the number of reports. Now, this is a bit of a logic synapse, this one, because this is where the top graph is the number of family reports where there was a female affected member where there was also children present. And the bottom one is the number of reports where there was a male affected person and there was a child present. So immediately we know that if a female was affected by violence, it was far more likely to be children present as well. And that's really what this one is saying. And it also showed that it went up during COVID. And that was true of anything that happened in the home setting, whereas other crimes against the person that were outside the home tended to decrease. So it is an important one. And another one we're trying to get is level of fear, but we haven't managed to get it yet, but we're close to getting it.
Did you just say level of fear?
Fear, yeah, at a family, when in family violence incidents attended by police, because we know there is a strong divide in the level of fear felt by females compared with males. And that's going to show it, but we know it's true, but the Crime Stats Agency are going through very rigorous protocols. Is the data good? The way the forms are filled out by police, is it consistent enough over enough period of time to provide this and know that it's rigorous data? So they're very careful before they'll release it. They're really good at what they do, I must say. Very, very good at what they do.
Thank you.
Yeah.
Before we leave this, often the questions we get are about family violence related to particular lived experience, say of migrant experience. Is there any way that and Tara, for you as well, before we finish up, is there any way that the data collections that we've presented today, the tools, are able to describe that experience by that lived experience of being a migrant or from another country?
You want to go first, Tara?
Yeah, sure. So in the eScan, we've mapped out all throughout our LGAs like who was born in Australia, who has a parent who was born in Australia, who has a parent who wasn't born in Australia, how many people have two parents that were born in Australia, what languages are spoken at home, what are the dominant like cultural groups in each regions, and so forth. So that's all that we've all mapped that in our eScan. And what we've also done is therefore map out I guess the health inequalities in those regions and kind of make evidence-based recommendations and statements to why things are presenting the way that they are. So for instance, with other available data demonstrating that those who are from, from a particular cultural group find that accessing healthcare can be quite culturally unsafe. Therefore, there are health inequalities within this region, da-di-da-di-da. So it really helps us inform and make those sort of, those informed decisions and those informed statements, which really help us therefore create advocacy pieces such as campaigns, or inform workshops in particular regions, even inform how we're going to write up our submissions depending on what the topic is about. So yeah.
Thank you so much, Tara. Jenny, did you want to?
Yes, I do, because this is one of the 3 we're trying to get from Crime Stats Agency. There are issues around whether we get country of birth is that useful if the person's been here for a number of years. So it's probably more likely to be based on language, whether English is a first or second language, and even that, how well is that recorded by police attending incidents, is that's all being looked into.
Yeah.
But in the meantime, on the atlas itself, if you clicked on from the homepage and you clicked on national and statewide resources, which is the second one of those shortcuts on the right-hand side, and if you clicked on migrant and refugee within that, so this one will give us the PDF, and there will be a section in that on violence against women where we'll have some of the major reports that you can get. So if you just click on violence against women within that, in the contents there, it'll jump down to it. Now, just bearing in mind, these are not going to be for your Southeast region. They're just going to be broader things that we're aware of that have data in them. So that's as far as we've managed to do anything.
But what's beautiful about that is you've done the curation.
We have.
You've done the curation of the source, so you don't even need to second guess if it's credible, because you've done that heavy lifting.
Yes, and at the end we've got a thing. If you know of anything else, please tell us.
Please tell us.
We'd like to add it. So it's always changing, and whether we keep it up to date, it's like your environmental scan. So much work goes into putting that together and just putting the feelers out. And you can put things in even about individual localized studies you might be aware of that maybe only about one or two local government areas. We could never do that. I mean, that's just the Rolls Royce sort of thing you've got going there.
Amazing.
Yeah.
Thank you. I think, colleagues, we might draw that to a close. We will do that thing that we do, which is just, if anyone can just go to that post survey to let us know. I know that sometimes we're a bit, we're data nerds on this call, but the evaluation of capacity building and these sort of activities is really important, because it enables us to, and I've just put the link in there now, it actually enables us to track if we're making a difference. And all the women's health services across before, what we do is we collect this data together as well. So if you can just take a little moment to just change that. I think where we'd like to leave you with is that the data is the start of the journey, not the end of it, and that there are resources out there to try to make that journey a bit easier. The next step is, after you've discovered the data and learnt for it, is to have the conversation and to create meaning about it. And hopefully we've given you a little bit of an understanding about today how you might do that. But the truth is, give us a call. Jenny, I think, has said about 3 or 4 times in the discussion today. Let us know what you think. We will be sending out contact details and everything to you, to the participants today that we talked about today. So you've got that. But Jenny has talked about, let us know what's going on. Let us know what you want, because we can't do this work without feedback. And the same goes for WHISE. We welcome the feedback and the opportunity to have conversations, because at the end of the day, we can't create health and wellbeing in our community unless it is a collaboration and a partnership. So I might give people some time back in their day. What do you think, Jenny and Tara? Is that a good idea? That's a great idea.
That's great.
Thank you for the opportunity to share what we do, because it's there for being utilised. That's the main thing.
Absolutely. More people that know what's out there, the better. Thank you very much, everyone, for your attendance. I hope this has been helpful. This is the first session, anything like this, that we have run for colleagues in Parliament and councilors as well. So if you think this is going to be helpful, let us know. I know that some of the other women's health services want to run something similar as well. So thank you so much. We look forward to emailing out the resources to you. Take care and have a marvellous day. Look after yourselves. See you later.